So welcome to the Practice Management Study Club. Today's topic is how to implement a performance management system that works. It is being presented by Sandy Balarjan, and we will begin the webinar shortly. And with that, it is my pleasure to turn the reins over to Joanne Friedman, Territory Sales Manager in Canada. Take it away, Joanne.
Thank you, Jessica. It's my pleasure to introduce Sandy Balarjan. Sandy is a leading authority on how to increase the effectiveness of dental business systems. Sandy is the author of 3 textbooks, Dental Office Administration, first and second edition, published by Top Hat Publishers, and the Canadian Dental Office Administrator, published by Nelson Canada. She created the first certificate course in dental practice management at the University of Toronto, Faculty of Dentistry. Sandy has lectured at dental faculties across North America and has had articles published in many journals, including the Journal of the Canadian Dental Association, Oral Health, Spectrum, Teamwork, Just for Canadian Dentists, and many other publications. As owner-operator of Dental Office Consulting Services, Sandy specializes in dental practice management, consulting, hiring, coaching, and training dental teams, implementation of in-office programs, dental business, and operational plans. Sandy?
Thank you so much, Joanne. That's great. It's a pleasure to be with you once again this evening. And tonight we're going to be talking about how to implement a performance management system that actually works and links the goals and objectives to, excuse me, I just have a call coming. Ignore, please. A performance management system will help your team to drive towards measurable results for the practice that they can actually control within their own job description. So that's really the most key thing that we'll be talking about tonight. This webinar will help teach team members how to set individual goals that align with your overall practice goals. So at the end of the evening, you will know how to set measurable objective goals for the practice, understand how each individual's personal goals align with the overall practice goals. We'll be talking about that quite a bit, and also how to create management reports that are needed in order to produce a quarterly scorecard. So to begin with, the process of personnel management is based on performance that consists of 5 steps. First and foremost, clarifying each person's role and what their role is within the practice and how interdependent your team members are on each other. So it's important for them to understand how they play a part in the overall success of the practice. And then how to plan the performance. So planning performance of each individual and helping them to plan their own performance. That's really the key to success in this program. And also then to coach performance and then evaluate their performance. We've talked about that in past webinars about how to do performance reviews. And tonight, this will help you also to perhaps incorporate this type of process into your performance review process, because it will provide you with objective data that the employee has some level of control over, that will help to engage the employee a lot more in the whole entire process. And then finally, in rewarding performance, I have used this system, and I do use this system with many of my clients, and some of whom like to have bonuses. That's the subject of our next webinar in May. But anyway, if they do have a bonus system, then I really strongly advise them to use this type of system to make sure that the objectives of the practice are being met. And that's really the key in the overall success of the system. We're going to be talking about, this is a sample of a performance agreement scorecard that you can include with your performance reviews. And I'll be going through how this is set, how to make the measurements. But basically, it's a matter of deciding on what's most important to the practice. So for example, financial performance, of course, is important. Team member satisfaction, you don't want to be having a lot of staff turnover because that can cost the practice a lot of money. patient satisfaction, and you know if your patients are satisfied, if they're referring new patients to your practice, and so on and so forth. So we're going to talk about a lot about this this evening. And then once you've decided what's most important to your practice, then how is that going to be measured? And that's where you reach your measurable objectives to determine how you're going to measure that. And then from that, then you set goals and establish activities of how you're going to reach those goals. So in other words, an action plan. And that's an area that I find is left out a lot in offices, especially during staff meetings. Staff meetings, I find that sometimes things are rehashed over and over again and results aren't really being achieved at staff meetings. And it's a waste of time and money for your practice to be paying everybody to be there at a meeting and nothing is accomplished. So it's really important to have action plans and measurable action plans and time bound. So we're going to talk about all of that tonight and how it all works together. So this system helps to clarify the roles in the office. And each individual would have their own agreement scorecard and performance agreement scorecard. And this one I just put for the office manager as demonstration only because an office manager really oversees the entire practice, basically. This helps to define any measurable objectives that you want to achieve, and it also helps to coach performance and rewards achievement, but mostly it really engages your employees so they have an active part in your success and an active part in the overall success of the practice. And also then they don't see the management functions as cumbersome. They really see that they're part of in control of their own job and their own activities within that job. So it's important to link the team individual goals and accountabilities to the overall performance goals of the practice. This helps to implement and maintain a performance checkpoint process. So as you'll notice in the last slide, I'm going to show that one again, but we have, I usually recommend quarterly checkpoint processes. If you're doing something monthly, that means that it takes a lot more time. It's easier to do it quarterly, but you need to track things on a monthly basis. And I'll explain what I mean by that in just a moment. Develop a clear link between performance and rewards. One thing that this system will do is it will help you when it comes to your performance review process time. It will help the individual to already know, they know by how they're maintaining the budget or how they're staying on track with their personal goals, how well they're going to do during the performance review. So it's a really good objective method of doing performance reviews. Align performance objectives with your budget. So the first step in this is having your budget set in place. So you need to look at what your numbers were, project where you want your numbers to be for the next fiscal year, and that's your starting point. So that's where you're going to see how much you want to grow, in what areas you want to grow your practice, which would be all areas, and to set the goals and targets for the coming year. This way, your team members are committed to your budget, even though one thing I will caution you about is when you have team meetings, not to talk about just numbers, because I'll tell you, first of all, it bores the staff members, the team members. It doesn't excite them at all to know how much money that you're making at your practice. What does excite them is to see how they're achieving their own personal goals within your practice. And that's what gets them engaged and excited and enthusiastic about reaching those goals and hopefully exceeding them as well. It's important to each person's job or their job description. Their performance level will be determined, and that is through their job description. The role clarity helps the employees to understand what's expected of them. So I'll give you an example of this. When I've rolled this system out with many of the practices that I work with, a dental assistant, for example, will say, well, I don't have any control over the budget. That's got nothing to do with me. I'm assisting the doctor. Well, a dental assistant has a lot of control over the budget because She or he generally does the ordering, the clinical ordering, inventory control, as well as the speed of the assistant and the efficiency of the assistant can either help the doctor to increase his or her productivity, or the opposite is also true. If somebody is slower, maybe a little bit more awkward, even maintaining the equipment, you know, the hand pieces and things like that, how they're maintained, and it is a very important part of the entire budget process. So each of your employees may not think that they're involved in the budget, but they truly, truly are by everything that they're doing with their jobs. They also have to know what decisions they can make and what actions that they can take to achieve what their own personal goals are. So everyone in your organization is accountable for achieving results within the framework of their own position. Just to give you another example, the person who's at the front desk has complete control over your accounts receivable and making sure that those are followed up with and collecting money at the time of service. Also your schedule, that has a direct effect on the productivity of the practice. So that person can directly affect the revenue of the practice. And so that's why it's so important to set these goals with that each individual member of your practice. So activities describe what the employee does to achieve the objectives within each person's individual performance. So it's important to start with determining what's most important to your practice. Of course, financial performance is extremely important because it is a business you're running. And that would include increasing revenue, of course, but also decreasing and controlling expenses. Those are two things that are really important, and especially controlling your staff costs. So that's part of what would be included in financial performance. And your accounts receivable. If your accounts receivable, if you are operating within 90-day accounts, I'm working with someone right now that I'm trying to get their receivables down. Because of the fact that if somebody is in a 90-day category, that means they haven't paid you in 3 months. They have the dentistry in their mouth and they haven't paid you in 3 months. So it also means they have no intention of paying you. So those accounts need to be followed up with quickly. So your accounts receivable are part of that. The revenue, of course, that's the day-to-day activities, and also the expenses as well. Team member satisfaction is extremely important because the cost of staff turnover is horrendous, especially now. Now there's a shortage of staff, and team members are asking for more and more money, and it's getting really tough to maintain staff members because of the fact that they know that they can get more money at other practices, and a lot of them are working that way. You know, just they'll go one place, and if they're offered more money, they'll leave the job quickly. So not a lot of loyalty there, unfortunately, but that's just the time and the environment that we're working in. Team development is very important. So having everybody working together in a cohesive team is extremely important. They have to be happy in their workplace, and also everybody having all of their oars in the water going in the same direction is really important. Patient satisfaction, your practice should be growing at a minimum of 8 to 10% per year at least. And the way it grows is, of course, obtaining new patients and having new patients, having your existing patients refer their friends and family. I always say you can quadruple your practice if you ask for referrals. And it's a very easy way of asking for referrals, simply by when the patient is happy with the services they've received, then say to them, did you know that we're accepting new patients? Would you like some business cards? And you can hand them out to your friends and family. We'd appreciate the referral. It's that easy. You don't have to, it doesn't have to be like a sales presentation. It can just be an information session by saying, did you know that we're accepting new patients? And that's an easy ask for referrals. The quality of the care, of course, you have to maintain the quality of not just your clinical care, but also your customer service as well. Those are extremely important factors in order to keep your practice growing and to have new patients want to come to your practice. So why do you do this? You have to decide on what's most important for your practice. And that has to represent an output, in other words, a result, not necessarily an activity. So for an example, if your output or your result is increasing your daily production, then the activity would be filling the schedule, confirming appointments. It could be anything like that, you know, avoiding no-shows and short notice cancellations. So that's an activity, but the result is increase in revenue. So that's what's important to think about. Lead to associated goals which are measurable. If something is measured, it gets done. So it's very important that they are quantifiable and measurable results. And that gives objectivity to the actual activities that they're doing. It has to be an important part of the position. So calling patients who are late for appointments or who haven't shown up for appointments, calling your recare lists, making sure that the next appointments are scheduled. So those are important parts of the position. It must also be within the actual limits of the authority. I've used this example in past webinars, so forgive me if you've heard this one before, but I had a dental assistant who I asked her if she could stay within 5% of the budget for sundry supplies, and she said no. And what I realized was I wasn't giving her correct information. So I gave her something that was relevant to her. She does the ordering. She does the ordering of the clinical supplies. I gave her a set number for a budget. I said, do you think you can stay within this number? She said, probably not, but you know, I'll give it a try. And I tracked her for 6 months, and she came in at 4.5% when I said, you know, do you think you can keep the clinical supplies within 5% of the operating budget? So I gave her information that wasn't relevant to her the first time. Then I changed it and realized that I had made the mistake. I told her the wrong thing. When I gave her something that she could relate to and that she could actually accomplish, then it was meaningful for her and it actually got done. So the outputs should answer the question, why? Why do you want to increase revenue? Why do you want to decrease expenses? You know, what are your goals and objectives there? And the results of the goals should be the output of the entire team. So everybody works together on this, and but everybody has the authority and the ability within their individual role. So to judge whether or not you're moving forward with your goals and achieving them, your objectives need to be measurable. So you need to have something that is quantifiable that you're able to actually see and relate to. So for example, are you on target with your budget? If you've set your budget at a certain percentage of increased revenue, are you on target for that? Are you growing, or are you going in the opposite direction? And then once you've decided that, then it's much easier to set the strategies on how to get there. So, and I'm going to show you an example of an action plan in just a moment as well. So metrics are objective data. They tell you how well you're doing at attaining your goals. And that's something that can be on your performance agreement scorecard. And it's something that your employee will already know. So they're going to, when they come in for their performance review, they're already going to know how well they're doing because they can see the results. So the metrics must be specific and they must be quantifiable. For example, using quantity would be how much or how many. So if you want to grow your new patients per month, how many new patients per month, you can set a quota, let's say, of 30 new patient exams per month. And I will just tell you with tracking, when you're tracking new patient exams, here in my area, if you track it according to the procedure code, the complete oral exam is exactly the same procedure code as a new patient complete oral exam. So you have to be careful how you're tracking that. I generally, at the offices I deal with, I ask them to track their new patients manually. The quality of service, how well we did, and you'll know that by if you have increased referrals from internal referrals, not from necessarily your marketing efforts, then you know that the quality of service is good. Most metrics will come from, for example, the quantity, the number of patient appointments, the number of treatment plans that are being completed, the percentage of downtime lost, and then if you have lost downtime, then the percentage of downtime filled. I'm going to show you a tracking sheet where we actually will track not just the downtime, but the number of recovered units that have occurred as well. The quality can be tracked in terms of a percentage of patient complaints and patient feedback, if patients are giving you really positive feedback. Also, try not to be afraid of complaints, because complaints can be a good news story because of the fact that it points out something that you may not have realized, and you need to thank your patients for bringing it to your attention, because most patients won't tell you. So they'll just leave your practice. So it's better that they tell you it's something that you can correct, and I would thank them and be grateful for receiving it. The revenue and expenses, is the actual revenue compared to what you have budgeted for. Sometimes it can be an adjustment that needs to be made in your budget or your projections. Sometimes it's an activity needs to be improved upon, or that type of thing. Time, when are you sending your action plans? It's very important to make them time bound. So when do you plan on achieving this? Let's say within 24 hours, by the third Monday of each month. You can set your own time goals, but that's an important thing when you are working with action plans, and that's sometimes the missing element. What I do with staff meetings is I will set the action plan. We will decide who's going to be responsible for this activity and by when. And then at the very next staff meeting, we go through all of the action items from the last meeting to see what's been accomplished and what hasn't been, and perhaps why. Feedback is, that's usually from the customer or the other team members as well, can provide you with feedback. And operational efficiency, so that would be based on scheduled number of treatment plans, scheduled appointments, adherence to compliance standards, and that type of thing. So this is how you would decide first what's most important to the practice. So what's important here is the financial performance. We're going to go through that first. How are we going to measure it? Well, based on EBITDA, which is earnings and efficiencies before interest, taxes, depreciation, and amortization. And we will also track the accounts receivable. We want to set a goal for how we want the receivables to look as a percentage of the gross billings. Staff costs as a percentage of production, and expenses as a percentage of production. All of these things you are able to create an action item from, and a strategy on how to achieve these things. And that's where you need to be really specific on how you're going to do it, who's going to do it, and when they're going to achieve it. So, it's very important also to be realistic when you're setting goals, to make sure that they make some sense. They should be a little bit of a stretch goal, but also at the same time, if they're completely unattainable, then it just becomes a joke. And I will tell you, I was in an office one time where the management, it was a multi office. There are a lot of offices in this company, and the budget was set so unrealistically that the employees there thought it was a joke, and they made no effort to work toward it, and they made no effort within their own individual goals to set goals that were realistic, because they said that the budget was out of touch with reality. So that's an important thing to keep in mind. So the goals should be SMART goals that each person sets. They should be specific. They should be measurable, attainable. So that's within their realm of authority. They should be relative and related. So something that the person can relate to, and time bound. By when do you want this to be achieved? So setting goals is basically stating what the objectives are. So what the objectives of these achievements. So these are highly specific written statements of what it needs to be accomplished. And they typically include the time frame of accomplishments. For example, when, a quantitative measure, how many, a qualitative measure, how well you're doing this activity, a measurement of cost, how much is it going to cost, and so on and so forth. So why do you bother setting goals in the first place? Because it gives you and it gives each individual in your practice control over the way things get done. If you have a goal and a plan in mind, then you're more likely to achieve that, because you're automatically, your subconscious and your conscious mind are both working toward that goal if you've stated the goal and you've stated the objective of why you're doing that goal or why you're setting that goal. It helps you to work smarter, not harder, through much better planning. So it's a way of planning out your activities on how you're going to do these things and how they will achieve the results that you're looking for. They also create clear focus on useful results. So that's the output or the results that you're trying to achieve, rather than just on the daily activities. And goals work together with action plans, which is the most important part of that. They become the tools for implementation. So you actually achieve the goals and they're much easier to attain. So goals help to plan for budget and for resources. So you have to have the resources in place in order to do the planning. Goals help you to set priorities as well, and how to control how the job gets done. That's really a key thing for your employees. They have to have some level of control and authority in order to be able to get the job done. They create clear focus and direction, and along with action plans, those, as I say, are your implementation tools. They need to be very specific and clear. So they can't be a wish list, for example. So you need to be very specific on what you're trying to achieve and how you're going to achieve it. So for example, goals expressed as improvements using words such as increase, maximize, decrease are unacceptable because they're not quantifiable, and they're more like a wish list. I want to improve my revenue. I want to increase my revenue. Well, how much do you want to increase your revenue? And then what action items, steps are you going to take in order to do that? They can be converted to measurable goals by asking yourself questions like when, where, how often, and how much. So just by asking simple questions, you can quantify your goals. They provide clear and understandable direction to your employees, and they're a tool for planning. So if everyone is following this type of system, then you can plan out your productivity, you can plan your projections for the coming year, and overcome any obstacles as well to achieving those goals. So that's a key thing to keep in mind. Goals relate directly to the individual's role within the team. So if they have the ability and the power to control a certain aspect, like ordering the supplies or controlling the schedule and avoiding no-shows and short notice cancellations, or with hygiene, it's very easy because they're producers. How much do you want them to be producing per hour, per booked hour, and that kind of thing. So each person has specific roles within the overall goals of the practice. Goals are the criteria used to measure and coach performance as well. So you need to determine how they will be tracked, so how the measurements are. And it's very important to make sure that the cost of the measurement isn't outrageous, so it doesn't overtake the actual goal itself. Do you use tracking systems, for example, logs, reports, budgets? Do they exist? Have you worked on a budget? I have to tell you that many of the offices that I've worked with did not have a budget in place. They do now if they've been working with me, because it's very important to know where you're at and know where your expenses are sitting at. And if there are problems if the expenses are too high, then you have to determine what needs to be done. And I'll just give you an example. I've used this in past webinars as well, but For example, some of the benchmarks that I look at the staff costs, I look at the equipment, the cost of equipment maintenance, I look at your lab costs, and that automatically gives me strategies in my mind. As soon as I see the budget and I set the budget, I know exactly what I want to do with that office and what strategies we're going to implement. For example, if the staff costs are too high, I can guarantee you there are openings in the schedule. If the lab costs are too low, then there's a very good chance that you're doing the bread and butter services, but not necessarily any of the major treatment plans, which means that I would concentrate on doing some treatment planning with that practice. The cost of equipment repairs, then I would look at how is the equipment being handled. Does some of the equipment need to be replaced? So that would, we would look at capital planning. So there are various clues that you get when you are working with your budget, and you start off with your budget and make the goals quantifiable and measurable. This is just an example of a hygiene monitor that I use. It's very simple to use. You can use it in Word format or Excel. Excel is really easy because then you can just add up the, do a sum on the bottom, and then you have all those numbers. But basically, I track the available number of hours of the hygienist, how many visits that he or she had, the number of recall exams. This is kind of important, but it depends if you have associates in your practice too, because you want to know how many, if the associates are how many recall exams, because generally in most offices that I work with, the associates get paid as flat amount per recall exam because the actual exam fee goes to the doctor, if that makes any sense, to the owner rather. The number of open units in their schedule, short notice cancellations, no-shows, recovered units. So if you had, let's say, a short notice cancellation or a no-show, and then you were able to recover that loss of units, then that's important. PHTP is a program that I have at my company. It's called Prescribed Hygiene Therapy Program. Basically, it's a soft tissue management program. How many of these were presented to your patient and how many actually booked? So this gives you a lot of really important information. I find what it tells me is if I have one hygienist, for example, who has a number of openings, why are people not showing up for that hygienist? So it can give you a lot of really valuable information. And also, maybe you have to cut back on hygiene hours. So if you, let's say, for example, one person has a lot of downtime all the time, then maybe that you need to cut back on their hours in order to get the appointment schedule worked on. And so you can increase their hours at a later time. This is just an example of, I call it a clinical dashboard report, but basically it will track each of the doctors and the hygienists and what their total production was, the number of days worked, what their average daily production is, and this is where you can set some goals, their available hours, downtime units, and that will translate into, and then the recovered units, and that will translate into downtime hours. And then what their hourly billings are. So it's very important too to watch with hygienists, what their hourly billings should be. You can see that these hygienists are booking and billing consistently about the same, but sometimes I've been in an office where I'll have one hygienist that they're billing way below. So I want to find out, does that person have a lot of openings in their schedule? Are they billing the same? And that's really important. If you have multiple hygienists, you have to make sure that they're billing the same, because otherwise patients will catch on and then they'll want to go to the hygienist who bills less, but you want consistency in your office. So this is a good one-stop shop to look at everything. What are the total collections for the month? Were there any write-offs? This is an important area to watch for, because if there are a lot of write-offs, I've been in offices where write-offs were being done instead of doing instead of doing a proper credit adjustment or debit adjustment to correct an error, they were just doing write-offs, and write-offs affect your taxes. So it's very important to watch what's going on there. Sometimes there can be some other things going on in your practice as well. Your accounts receivable is extremely important to keep an eye on this. Make sure that your over 90-day accounts are, hopefully they're zero. But if they are in this category, in the 60 to 90-day category, then they're creeping up there. So those are things that I would say to keep an eye on for sure. The number of cases presented, how many of those were booked, how many of just simply estimates were sent out, and how many of those were booked, and then the total of outstanding treatment. So it just gives you a whole idea of what needs to be done at your practice. So that's the tracking part of it. Your goal needs to be attainable as well. So is it within that person's authority to be able to reach their goals? Does the person have enough control over the influence or the end result? Is the goal related to the main objective? So for example, if your main objective is increasing your revenue, then you would want to watch your appointment schedule and get the unscheduled treatment plans booked, and make sure that all the hygienists had all the future hygiene appointments are booked. So does it measure successful delivery of what's most important? And also, are the goals compatible with those of the team? So making sure that everybody is on the same page, everybody is going in the same direction is really important. Time is one of the easiest elements to include in a goal. So by when do you want to achieve this by? And that's why in the performance management system, we're doing it quarterly. A goal that's set too short for a time period is often just a prediction, because it does not require your action to bring it about. The other reason I just wanted to mention that I set these goals in quarterly increments is because of the fact that sometimes you'll have a month that's down a little bit. You might have a lot of cancellations. You might have a lot of holidays during that month, or people might be away on vacation. So the budget kind of fluctuates a little bit. And if you have a reward system attached to this performance management system, then and you're doing it each month, it can run into some difficulty with if they don't meet budget that month. And I'll explain that more in our next webinar when we're talking specifically about bonuses versus benefits. A goal that's too long of a time period is more like a hope or a wish. That's part of your wish list. And too many uncontrollable events can occur during this period. And a perfect example of that was whoever set their budget for 2020 certainly had to make some adjustments, because no one expected what happened with the pandemic. So an example of what's important, for example, is, well, let's say patient satisfaction. How are we going to measure patient satisfaction? Well, we're going to measure it by the number of referrals, from internal referrals. And so what's your goal then? The goal would be to have 50% of new referrals this fiscal year will come from existing clients or existing patients. So that is a more specific goal for something that is maybe a little bit non-specific. So here's some examples of non-specific versus specific goals. So you want to increase your revenue, decrease expenses, increase the number of new patients, turn it into something more specific. I want to increase revenue by 20%. Well, how am I going to do that? So that's where you set your strategy once you have set your goal. Decrease the variable expenses by 10%. How would you do that? Inventory control, making sure that you have a budget for spending. I forgot to show you that on the clinical monitor, but I also, from the collections, it will automatically put the formula into the sundry supplies, and it will set it at 5%. So then you know you always stay on budget with that. Decrease the variable expenses, increase the number of new patients to 40 per month. How would you do that? Through a direct ask for referrals. So your action plans, these are the most important part of the entire system. They must be time bound, and they need to have clear accountability. So a sample action plan without dates is to increase revenue by 25%. The plan would be, how are we going to do that? Schedule all unscheduled treatment plan, including any outstanding treatment plans. So you've got one person working on all of those outstanding treatment plans. And I always do this at offices. I work with this to make sure that that those outstanding treatment plans are being followed up with. Because if you have taken the time to provide the patient with a diagnosis and a treatment plan, but the treatment plan's never followed up with, then the patient thinks it wasn't important. Because remember, a lot of times they're asymptomatic, so they don't think that they're not in any pain, so it's no sense of urgency. But if somebody follows up with it, then it creates more of a sense of urgency, but it also makes sure that that patient believes you and trusts you, that you have told them that they have a diagnosed condition in their mouth and that they need to have it fixed. So another thing too is to build treatment planning into your schedule. Say, for example, if you have a certain downtime every day, then use that time productively by doing your treatment plans, do your complicated treatment plans. Or the other thing that I like to suggest to practice owners is to work with your associate during that time. Ask your associate to have a little meeting with your associate and talk about treatment planning. Be a mentor to the associate and help them to achieve their goals and desires as well. To decrease the accounts receivable. How would you do that? By simply starting with the 90-day accounts and following up with those first, making calls to patients, making calls to insurance companies. So somebody has to actively be doing the actions in order to achieve the results. So here's another example. The action item is to schedule any outstanding treatment plans. Who's going to do this? Sandy will do it. By when? By December the 1st. Also for accounts receivable, what's the action? Send statements. Who's going to do it and by when? Same thing with entering all treatment plans into the computer. Who's going to do that, and so on and so forth. So you can judge the activities and tie the activities that you're doing into the goals that you're achieving, and most importantly, into the action plans. That's really the key thing. So how you put it all together in a performance agreement is, again, stating what's most important to the practice, the financial performance. How is that going to be measured? We're going to measure it through our EBITDA, as well as accounts receivable as a percentage of gross billings, our staff costs as a percentage of production expenses as a percentage of production as well. And then what's the goal? Well, we'd like to increase it by 25%, have our accounts receivable less than 90% of 1 month's gross billings. Our staff costs should be 25% or less of gross billings. Our expenses should be less than 60% of production. So you can set your goals there. But once again, they should be a bit of a stretch, but they need to be specific on what you want to achieve, and then what the action plan is to get you there. If a person is to be held accountable for achieving their results in specific areas, it's important that they have a proper authority statement so they know that they have the ability to do that. So they have the ability to follow a certain guideline for their budget, for their ordering, have a system of irregular ordering or automatic ordering if that's the case. I usually think it's a really good idea to have one assistant sit with the salesperson, or the rep every month and go through the ordering and help her to stay on budget as well. So this provides the freedom to make the necessary decisions. And this is what empowers your employees. They need to feel that they have the ability to do these things, and then they will achieve them for sure. Authority statements identify the significant action that a person must take in order to achieve those results. And the actions may demand considerable ingenuity, resourcefulness, or creativity. So that's why I know a lot of dental assistants will do some shopping, they call it, to see what specials are on. If you have a major convention in your area, and the vendors always put on specials for those type of things. So that's a great time to do any shopping, especially if you're looking for big ticket items. It's a great time to do that. Guidelines for developing your authority statements. The person who's writing the authority statement must relate to it to what's important. So once again, you would relate it to something that is quantifiable and what's important in your goals. The statement must specify who makes the decisions and what actions are necessary to achieve the target itself. Because the bottom line is you can't be held accountable for results over which you have no control. If you have no control over the ordering, then how can you be responsible for the sundry supplies in the budget? For example, the statement might be that what's important is the financial performance. So I need the authority to be able to spend money within the budget. I need to be able to order the items that I need. I require authority to enlarge or decrease the staff or use overtime if that's necessary. That's usually the manager that would make that decision. I require the authority to make material substitutions. So if your assistant is ordering and she knows, she or he, but they know that you like using a certain material, then they can make those substitutions if one that you generally use is not available. So some tests for an action plan, it will meet the following tests. It will have a clear goal on what you want to achieve, what results you want to achieve in the action plan. It has clear activity steps. In other words, how are we going to get there? How am I going to achieve those results? The activities are properly arranged in sequence of priorities. So it's very important to make sure that you do the most important things first and make them sequential. It has suitable progress checkpoints identified as well. Some errors that can be made is that there's no review of progress. So if there's no review, how would you know if you're achieving the proper results? Or stating activities too vaguely so that their completion is uncertain, because if they're not specific, they won't get done. If they're not measurable, they won't get done. So it's very important to be very clear and very specific. Or if there's omission of key activities, for example, if somebody's in charge of reducing the accounts receivable and getting those 90-day accounts down, then they need time to do that, and they need time to spend on the phone to send statements and things like that, to follow up with emails. Or a failure to allow for activities of what others might hinder their own plan. So if somebody else is partly responsible for something. So say, for example, your activity is you're responsible for the accounts receivable, getting the accounts down, and then somebody at the front desk is not accepting money at the time of service, or they're letting the patient go without paying or without making financial arrangements, then they're counteracting what you're trying to achieve. So it's very important that everybody understands what the other person is doing, that everybody is accountable for their own results and they're within their own job description as well. It's important to have checkpoint meetings from time to time. The purpose of performance evaluations is to spend quality time with one-on-one with your team members, as we've talked about in the past. Meetings should take place at least quarterly when you're doing this type of system, and it provides an opportunity for to encourage the progress toward the goals and to help keep the team member on track. It also gives the team members an opportunity to discuss any obstacles that they might have encountered. For example, I didn't meet my financial goals for this quarter because, remember, the month of December, there were a lot of people off on holidays or there were a lot of statutory holidays and that kind of thing. Your office manager, you may or may not have an office manager, but they need to conduct their performance appraisal checkpoint meetings so that you can go over, your office manager can go over this type of system with each team member, and helps to keep them on track. The expected outcome of doing a performance appraisal checkpoint meeting is that people will stay on track and they don't necessarily drift. Problems are identified early and corrective action may be taken. It also tells your team members that you're on top of this, that you are committed to this system and you're committed to achieving these results every year. It minimizes the number of misdirected actions, which will deviate from the goal, of course, and motivational momentum is maintained. So start by asking these 4 questions. When you're doing a checkpoint meeting, where do you think you are relative to your goals? So that helps the employee to automatically start thinking about the numbers and about where their individual goals fit with those numbers. Where are you with respect to your action plans? You know, what have you achieved? Have you run into any obstacles? Are there any blockages to achieving your goal? Do you need any management support, or do you need any employer support for this? What are your plans to remove the blockage if necessary, and get the goal and plan back on track? So your performance agreement scorecard, your checkpoint meeting should also ensure that the overall performance agreement scorecard still makes sense. I've encountered this when I've had this in offices. Sometimes the goal is not necessarily that the activities of the individual are wrong. It just means that the goal may need to be adjusted. And it could be for extenuating circumstances, or it could be for things that aren't necessarily within that employee's control. So that's an important thing to think about. Have the employee's responsibilities changed as well? So this allows visible scorekeeping to maintain focus. It provides objective results for your performance reviews, which is a really great thing to have. It helps with self-management of performance tracking. So it helps your employees to become engaged in the whole entire process without saying they're responsible for the budget. They're essentially, what they're doing is assisting with the budget in their day-to-day activities. And also then the manager is not a threatening presence. The manager is there to guide and coach you, and to give you good news, give you the results on how you're doing. And there's also any record of performance variance. So this is what a completed one might look like. For example, the financial performance, which you've already talked about. This office has decided to measure it according to the budgeted revenue, accounts receivable. What are the goals for each quarter? That they want to achieve a budgeted projected revenue of 100,000 per month. In the first quarter, they achieved 120 per month. So we're going to talk about what you might want to do with that 20,000 in terms of a bonus system, if you so choose. But there are also, you can just leave it, and you don't know how the next quarter might be. This quarter might be when there's a shutdown, or something could have happened during this quarter. Team member satisfaction, how would you measure that? By perhaps staff turnover. You want to achieve less than 1% staff turnover rate by year end. Patient satisfaction, what's the number of new patients, of patient referrals? We'd like to have greater than 15% of new patients as referrals from existing patients, and retain 95% patient retention as well. That's really important. So there's all kinds of ways. I'm just going to drop down to operational efficiency. That can be measured by dollars generated per chair time or per booked hour, and what the percentage of open chair time is. So these are things to consider, and how much you want to achieve in that chair. So for example, you might want to change this to hourly as well. If it's a hygiene performance agreement, then you might want to change it to must achieve $200 per booked hour in terms of production, and what the open chair time is, less than 10% open chair time in the hygiene chair. So things like that. At each quarterly checkpoint meeting, you would meet with the employees, and then you would also give a year-end overall performance. And at each checkpoint meeting, they could you could put the date, and they would sign their initials on their scorecard. It's like a little report card, basically. And then you can reward for excellent performance. So there's a variety of different ways that you can do this. You can provide a salary adjustment, of course, or a bonus or commission. Not a big fan of commission, working on commission, and I don't necessarily advise it, but that's my opinion. That's not necessarily something that you need to do. You can give them a promotion. You rarely will not give a demotion in a practice unless somebody is really not performing, and then you need to do a performance improvement plan. Or you might want to give them a special a special assignment. Remember that salary increases needs to be based on merit of performance. We've talked about that in past webinars as well. So here's an example of an office manager. I just took one metric and just to show you what it might look like. So if the financial performance first quarter, they were doing 120 per month, their targeted production was 100,000 per month. And second quarter, they might have only achieved 90,000 per month. So you see how there can be fluctuations in the budget, and that's why it's important to think of it as quarterly and not monthly, because you first of all, it's too time consuming to do it monthly, and secondly, in the next webinar we're going to talk a lot about bonuses and bonuses versus budgets. This is a way you can put a bonus system in place. But I will tell you from experience, when you put bonus systems in place, if they don't meet budget, so say, for example, this second quarter, this office did not meet their budget expectations, which were 100,000 per month, then your staff get demotivated. So it can have the opposite effect. If they don't make budget, then they get upset, and sometimes they think it's punitive. So but we'll talk more about that in our next webinar. I just wanted you simply to see the different fluctuations, but the overall year-end performance worked out to an average of 111,000 per month. So they achieved their targets. So that helps you also for setting the targets for the coming year as well. So if you did want to put a bonus system, this is just an example of, and as I say, we're going to talk about this a lot more at the next webinar, if the 11,000 excess that they have produced per month, you can return half to the practice, and that would accommodate for months that bonuses weren't met. So that would be that second quarter there. You can give out the half of that, as bonuses, as cash bonuses to your employees. One full-time share to a full-time employee, and if somebody's part-time, they could get a half a share. But that's one way of doing it. If employees have just met the budget, so say for example they were consistent 100,000 per month every single month, then there should be some kind of incentive to move forward and to continue doing that. So I would give them a base of let's say $500 if you meet the expectations. If you exceed them, then you share in the profit. It's like a profit sharing type of thing, but it's a win-win situation because you as the employer and the practice owner have met your financial targets, and then the excess is helps to motivate your employees to keep going. So in summary, tonight we've discussed how to set measurable objective goals for your practice and how each individual's personal goals will align with your practice's overall goals. Thank you so much for having me, and I always enjoy working with NDX.